Hi everyone, my name's Anne Thompson and up to recently I was the lead pharmacist in the North East locality of Glasgow Health and Social Care Partnership. Today I just wanted to celebrate the work of the team in the North East, particularly in the last year, their resilience, their perseverance, their adaptability and willingness to embrace change, and most importantly the support that they've shown each other and of myself as well during what has been a difficult time for a lot of us. And the one thing I want to kind of recognise is the fact that they've managed within all that to deliver a new service delivery model, which we refer to as a hub. And the hub concept really is about trying to find a more effective, more efficient way of working that allows people to still feel that they're part of a supported team and can support each other to kind of troubleshoot and learn as we go with the day-to-day work. And it centres around delivery of prescription management aspects. It's based on a concept which was started off in Dumfries and Galloway, and we really wanted to take that and make that fit for our urban environment. And in the context of COVID, we could easily have just not progressed with some of these service developments. They weren't essential. They were really about trying to refine the way we work and optimise the way we work. But we didn't. We decided, after we realised COVID wasn't going away, that we still needed to progress with these innovative ways of working to allow us to deliver as effective and efficient a service as possible. The hub is technician-led, and we have recently brought in a support worker to kind of help with the workflow within that. So there's a lot of new aspects, a lot of change to be contended with, but we've worked through that change and we can now see how this can really make the way we deliver services a lot more comprehensive, a lot more efficient. Also, is communication with other parts of the system, particularly the likes of community pharmacy, and allows us to start to think about how we do communicate more regularly, more effectively across pathways of care. The other thing is it really optimises the use of the skill mix within the team, so we have the right people doing the right roles at the right time in the right place, and that allows us to advance practice both in pharmacists and in pharmacy technician roles, and working, as I say, in an effective way by utilising support staff, our administrative staff, and the wider practice teams as well. And hopefully that all adds up to being able to provide a really comprehensive, holistic, quality service that delivers as effective care as we can for patients.
Hi, I'm Elaine. I'm the pharmacy technician that's processing your IDLs. I've been in this job since January of this year. Myself and Jen, who is a lead technician, set up the hub back in July, and since then we have processed over 2,000 IDLs. While doing this, we've also managed to pick out patients that we feel need polypharmacy reviews and pass them on to the pharmacist to do this. It has been a bit of a challenge at times with the increased volumes of IDLs that we've been processing. However, this is now settled down, and I'm quite enjoying helping out the practice with this. Helping me with this process is our pharmacy support worker, Lizanne, over there. She has been an absolute godsend. She has been really supportive in liaising with the community pharmacies with changes, with the practice, with the patients, with secondary care if required, to clarify any points that need clarified, and basically helping the hub run really smoothly. I couldn't do without her, but the whole process is to make the patient's journey as flawless as possible, going from acute care back into their home or into nursing homes. I do miss the contact in the GP practices, although when I do speak to the staff there, I really enjoy talking to them, catching up with them, and they are more than helpful with any queries that I may have.
Hi, my name is Pamela Innes and I'm one of the joint interim leads for the North East of Glasgow. I would like to share with you a polypharmacy review that was carried out by myself. The patient was highlighted to me by the pharmacy hub, which processes immediate discharge prescriptions. One of the technicians had realised when processing the immediate discharge prescription, the patient had not ordered their Bisoprolol in the last 6 months. I contacted the patient and it quickly became apparent that she was really unsure about her medications and the reasons why she was prescribed them. So I spent time discussing each medication with her, why she was prescribed it and how she should be taking it. The patient was really thankful of this, and her compliance has greatly improved since. When looking into the Bisoprolol, there was no reason the patient could think of why she had stopped it. She just thought she had been quite confused. So we restarted it at a low dose with a view to up-titrating it as per the patient's heart rate. The patient had also been suffering from a dry mouth, and it was possible that this was caused by the medication tolterodine that she was taking for incontinence. On further questioning, this didn't appear to be helping her incontinence, and we decided to stop it and refer her to the continence service. The continence service reviewed her and discovered that she had a prolapse, and she was referred on to secondary care. We also reviewed her cholesterol medication. The lady was 80 years old and she was on 2 different types of medication, and her cholesterol was very well controlled. So we decided to stop one of the medications and review her at a later date. So in summary, this review stopped 2 medications that were no longer necessary for the patient, and also stopped the side effects of dry mouth from the tolterodine that she was suffering from. It also greatly improved patients' compliance and understanding of why she was prescribed these medications. The patient was extremely grateful, and she continues to be reviewed.
Our discharge letters were being done initially by the pharmacist, but certainly since the technicians have taken over, I mean, we've not noticed any, there's not really been any, it's been quite smooth really. The team's really very approachable, and all the pharmacists are really approachable as well, and so we're really happy with it. Yeah, no, it's going really well. Yeah, we've got Derek, so he's been helping us with the acutes, and so he's been helping us do that. So that's been great, and that's taken a lot of pressure off us in the practice as well. So he's been doing that, and he's also been doing some reviews as well. So it's really sort of freed up loads of time really for the pharmacy team, and also for us in the practice. So it's really been fantastic. Yeah, no, really good. Yeah, keep up the good work. So no complaints at all. No complaints.
So I'm really proud that we've managed to progress that, and I think one of the key things around that was not trying to have everything perfectly planned before we started. Learning from the Louisa Jordan that sometimes you just have to have those mechanisms to learn as you go, but you have to kind of just go for things and experience them to know how to move forward. So as long as you know what direction you're going in and are brave enough to take that first step, then that's all that matters. And I'd like to thank the team for having the courage to do that. And now we are able to share that learning we have had from that experience across the partnerships, and hopefully support the wider service to move forward effectively and efficiently to deliver good quality care. So thank you for all of the folk in the North East who have made that a reality.